Okay, for the Ottawa ankle rules, it's inability to bear weight for 4 steps, either now or in the emergency room, and tenderness at the distal 6 centimeters of the posterior aspect of the tibia and fibula, the base of the navicular, and the base of the 5th metatarsal. This is the test item cluster for full thickness rotator cuff tear. So first, the painful arc sign. So go ahead and raise your arm out in front of you. And then the drop arm sign. So go ahead and lower it slowly. And then the infraspinatus muscle test. So can you put your arms like this? And now the test item cluster for subacromial impingement is the Hawkins-Kennedy test. So go ahead and raise your arm out in front of you like that. Okay. And then the painful arc test again, and the infraspinatus muscle test. Test item cluster for a patient who will respond to spinal manipulation. Be current episode of symptoms less than or equal to 16 days. No symptoms distal to the knee. FABQ work subscale score less than or equal to 18. At least one hypomobile segment. And at least one hip with at least 35 degrees of internal rotation. For a patient who would respond to spinal stabilization, it would be age less than 40 years old, average straight leg raise greater than 91 degrees, positive prone instability test. An aberrant movement present. Can you bend forward as far as you can? And backwards as far as you can? And then can you face me and do a squat? Good. Test item cluster for cervical radiculopathy. It's a positive upper limb tension test for the median nerve. A positive Sperling's test. Okay. Go ahead and slide it in. Positive cervical distraction test. Less than 60 degrees of ipsilateral cervical rotation. Okay, good. Okay, this is the test item cluster for mechanical neck pain that would benefit from thoracic manipulation. It's symptoms less than 30 days, no symptoms distal to the shoulder. Looking up doesn't aggravate the symptoms. A FABQ physical activity score of less than 12. diminished thoracic spine kyphosis, and less than 30 degrees of cervical extension. Dynamic test for lateral meniscus lesion. An anterior drawer. This is the upper limb tension test for the median nerve.
Okay.
We go ahead and bend your head.
Goes away.
Yeah.
Brings it up.
This is SI joint distraction. And SI joint compression. And the sign of the buttock. And Faber. Posterior drawer. This is the differential diagnosis of a rotator cuff tear or subacromial impingement and a C5 radiculopathy.
Well, some of it we should have, but I don't know. Like the test datum clusters. Do we have to have that? Does it say that in our rubric?
Your arms down.
Well, I think we should get a few of them today. I don't think that we need to do this.
I want to get the video of me.
Just like that. Good.
I just figure if we get a few, we can do that. Should we go?
Because over break, should we go grab a table?
We got a table.
Okay, do we?
And I would also test sensation in the C5 dermatome.